Ah,
Hello everyone, we will start our session in few minutes. Please mute yourself everyone, please mute yourself and open the camera everyone. Good afternoon, good evening, and good morning to everybody present here. Good to see you all. I hope you all are in good health till date, and I wish the same in coming days also. I, Manish Mehta, advisor of Youth Development Society, welcome you to all the session of cross-country exchange program on COVID-19. I know the situation is not normal. Despite this abnormal, difficult situation, I am very happy to see you guys and welcome everyone to all those speakers and participants. And I want to share little things about our organization, Youth Development Society. And Youth Development, this organization is working for all the youth of national and international for their upliftment. And YDS have done many programs like in World Hepatitis Day, in International Youth Day. And today's we have webinar about the pandemic situation of COVID-19. And today webinar is little bit different than previous day program. Today we have a speaker from 9 different countries. Today we have speaker from 9 different countries, and all the speaker have to say about the pandemic of his or her country, about the situation, and he or she should have to talk about the pandemic situation, how the role of government played in the eradication of COVID-19, and how the role of youth are playing the eradication and elimination of this type of this COVID-19. And he or she should must have to tell about the situation, about the cases, like whether it is increasing or decreasing day by day, and the mortality rate of the coronavirus. And let's start from the introduction. We have today's speaker from Nepal, Dr. Nicholas Busal. He is also the president of Youth for Nation. Please welcome him. Is Dr. Nicholas Busal.
Yes.
And similarly, we have from Australia, Abhyas Vastola. Please welcome him. And similarly, we have Carl Brown from Canada and Saprit Kaur from India. And we have Adnan Nasir Khan from Pakistan, Wood Sender from Haiti, and Sri Devi from Malaysia, and Abdel Nasir Mohammad Galal from Sudan, and Abid Buan Sravan from Bangladesh. And we are really happy. We Youth Development Society family are very much thankful to all of us who are accepted our invitation. And I want to say one thing, that every speaker from the 9 different countries have to have only time of 8 to 10 minutes. After 8 minutes, I will give any type of signal, like I will tell you to please conclude, and you should have to conclude in after the 8 minutes, because due to the lacking of time. And in this situation, I think out of the in the different foreign countries, there is mm, time zone is also little bit different from Nepal. So here she must have to talk only about 8 to 10 minutes, and after 8 minutes, I will give the signal, like I will tell about the please conclude. And starting from this session, I like to welcome to Nicholas Vasal to represent the Nepal. Please, Dr. Nicholas Visal, welcome him. From Nepal, representative Dr. Nicholas Bhusal, please.
Are you listening, everyone? Namaste, everyone. It's me, Dr. Nicholas Visal from Nepal. I'm the coordinator of Young Doctor Association, and I'm also the president of Youth for Nation Nepal. And today, I'm really thankful to Mr. Manish Mehta for giving me the opportunity to speak something over here. And I'm really glad to meet all of you to share some ideas that I have to each and every one of you. Currently, the coronavirus has become a pandemic all over the world. It has almost reached every country of the world. And currently, I just want to update the condition of Nepal till date. There are around 27,832 coronavirus patients in Nepal, and around 126 people have died from corona. The mortality rate is comparatively low compared to other countries in Nepal, and it's spreading gradually all over the areas. The government, the various organizations, national, international organizations are working, cooperating with each other to solve this problem. And just recently, what are the things that has been done and that are going to be done and that need to be done? We're also working in this field from last many months. Initially, we were managing the equipments, health equipments. Gradually, we were screening the program at various level, managing the quarantine, managing the isolation and all. During this pandemic, people are facing various type of problem. One of the major problem here is the fear that the people are having, and it's causing various major problem in our country, because more than 2,000 people have committed suicide during this time. And the main reason behind suicide is this lack of motivation and economic crisis, financial crisis, and various other reasons. And we, especially in Nepal, many people, especially the various youth organizations, are working in this sector, and we are the network of many organizations, 170 organizations, working together to tackle this situation. We are cooperating with government, we are collaborating with various other organizations, various other person, national and international organizations, to cope up with this. The best things that we are doing right now is we are testing the maximum number of corona is there. Last the total population of Nepal is around 28 million, and the WPA studied the maximum number of tests was there, and the maximum number of cases recorded till date in one day is around 1,000. The WPA studied there were around 1,300 cases. Yesterday there were around 700 positive cases, and today my camera is on. And today there is around 723 cases reported till this time, and the mortality rate daily is around 6 to 7 nowadays. Before few weeks, before 1 week, it was not so much. It was not spreading so much rapidly. From last 7 days, it is gradually increasing day by day. It's something as the condition right now of Nepal is something like that. It has already reached the community level, and it's becoming very difficult for the medical personnel like us to tackle the situation. And we are working in three level. One is central level, coordinating everything. One is intermediate level, which are coordinating the various provinces, and one is this local level. And the government, medical association, pharmacy association, and various other people are working together to cope up with this. The main thing that is facing that's we are facing the problem right now is the main problem right now. What we are facing right now is of the depression and anxiety that various people are facing right now, and the number of cases of suicide, the number of cases of depression, the number of cases of many people trying to move here and there is disastrous over here. And the condition of lockdown is also uh, the initially for the initial 3 months there was lockdown. It was opened on before 2 months, and from last 1 week there is a lockdown and there is closing in various areas. And I'm really glad to share some ideas. And the next strategy the government is undertaking right now, the Kalyan brother has informed about the recent data. It's 29,600 people have reported till today, and 6 people have died today. And thank you so much. And what the next strategy, what we are going to do, what the government is going to do is they are increasing the number of tests that they want to do. And along with that, uh, our medical fraternity is trying to segregate the COVID hospital from non-COVID hospital and manage the maximum number of doctors and volunteers to participate in this. And along with that, we are also starting various encouraging programs, various webinars to motivate people to keep the people with hope, to engage the people in various learning activities, educational activities, various other activities, awareness activities, and all. And really it's my time is about to complete. And finally what I want to say is the condition right now of coronavirus in our country is something increasing, very much increasing. and and right now we are in situation like it's reached the community level, and it's been very difficult for government also, and for us doctor also, and for other personnel also to cope up with this situation. We are really prepared for that. We are really prepared for that, and I think soon we'll tackle it. And we are really glad that about the vaccine, that the Russia, that China, Australia, and everybody are working on this. And I have read about it, read various articles about it, and it has got on the initial trials, it has got some results on the animal control and also on the human control. That's why we have some hopes, we have some faith with ourselves, we have some faith with our government, we have some faith with all the young generation that are working very dedicatedly during this situation. And we are really thankful to everyone who are tackling this situation with confidence, with inner willpower. And till now there are something better, because the mortality rate in Nepal is comparatively low, and the severity of disease is also not so much as compared to other countries. That's why we are hopeful that we can control the situation and we can get rid of it soon. Thank you.
Thank you, Dr. Nicholas Busal. Yeah, he has shared many things about the Nepal. And if you have any queries, any questions regarding the situation, if you want to know about the Nepal, you can write in the chat box, and we will discuss later after this session. If we will continue all those 9 countries, then after that we will discuss all these things what you are included in our chat box. And similarly, another speaker from Canada, Mr. Carl Brown. Please welcome Carl Brown.
Yeah, hi. Thank you. Nice to be here. So I'll quickly talk about Canada. So we'll go first with the numbers and the cases. So we've had 123,000 confirmed cases of COVID. 110,000 of those have recovered. So 13,000 that didn't recover. And of those 13,000, we've had 9,049 deaths. So in Canada, we had a lockdown starting pretty much March 20th and went to about July 2nd, and it was a total lockdown. Everything was closed except for essentials such as pharmacies and grocery marts. The way it was handled in Canada government-wise is that the provinces were in charge of the lockdowns within their own areas, and then the federal government was in charge of assisting financially and those kind of things. And we have a three-stage reopening strategy, and we're now in stage 3. So stage 1 was just opening essential small businesses to help them there. Second one was opening more businesses and allowing larger groups to meet, because for stage 1 you were allowed to meet maybe in a group of 10 at the most, and stage 2 they moved it up to 50, and then in stage 3 they're looking at like 200, 300 groups of 200, 300, and that'll be the final stage, and that's where we are now. Everything is pretty much back open. What the government has done currently is if they've created an app that they're asking Canadians to use that tracks who's been tested with COVID. So what it does is if you've been tested, you put in that you've been tested positive. The information's all anonymous. You won't know, but what it does is if you're close to someone who tested positive or in an area where COVID has been found to be happening, the app will let you know that you've been exposed so you can get tested. Because
not clear, sir.
for testing, we are only testing if people are showing symptoms or if they've been exposed, so in an area where COVID is recognized. So we're not doing testing other than that. And don't travel, where our border is still closed with the US, and with travel, it's only essential travel that is allowed. So there's not many people coming in, and immigration as well is controlled so that it's only immediate family. And finally, I guess we'll talk about the schools with the youth. So what we've been experiencing here, like we showed, previous doctor spoke about suicide rates here. Sorry, I'm having a hard time hearing, so it's getting cut off a lot. So I apologize if I'm not speaking clearly. What's happened here is we've noticed an increase in drug intake. Suicide hasn't been as big an issue as substance abuse here in Canada. So that's where we've seen some of the issues that we have to work on. And other than that, I don't think I have too much more to add. I think if there's a question period, it'll be easier to maybe answer what you would like to know
Yes.
about what's going on in Canada. So I kept it short and brief, so thank you.
It is our pleasure to have you in this session. And Mr. Calbron have also told about Canada. If you have any, please mute yourself. Please mute yourself, every participant and speaker. This is my humble request to everyone. Please mute yourself. This makes us disturbance to other participants. And similarly, going towards the next session, we have Mr. Abhyas Bastola from Australia. Please welcome him, Mr. Abhyas Bastola. You will
Hello,
represent
guys.
Australia.
Hello, guys. I was born in Nepal, and I live in Australia, Melbourne. I live with my parents at the moment. So just want to start off with the total number of cases of Australia is 24,236 today, like till now, and the recovery rate is 17,846, and the date is 463. So we got like 5 states in Australia, and I live in Victoria state, and where the COVID has hit the hard. So Victoria got like 17,683 cases. So that's the worst state hit by COVID in Australia. So what I want to say is, I want to talk about the government. I think government is doing very good. They're taking all these steps. Like we now today, so it's been like 2 weeks we are in lockdown of stage 4. And yeah, we're doing pretty good. The government is doing very good. The cases are going down. 2 weeks ago, the cases was like 728. It has gone down to 220, and also Australia is working very close with the Oxford University to create a vaccine. So hopefully we'll find the vaccine by the end of this year or maybe early next year. So what I want to say, you guys, I haven't done much research, but what I want to say is there is always light at the end. So please don't lose your hope. I want to say this to everyone. Plus, I live with my grandpa, so I don't go out much because, you know, old people get COVID easily because they don't have this immunity power and stuff. So talking about Victoria, our government, so in other states, they all people, they don't have lockdowns and stuff. Everything is going down, everything is going cool. But Victoria, we are in states for lockdown. So only one people can walk at a moment. So what I'm trying to say here is only an hour a day you can go out, only for 4 reasons, which is if you are giving a caretaking or caregiving, and the other reason is exercise, and the other reason is for groceries. So these are the reasons you can go out for an hour, not much. And we are having curfew from 8 p.m. in the evening till 6 a.m. in the morning. So it's been very, very hard, but at the same time, the government is doing this for us. So yeah, things are going good. So the Australian citizens, they are getting help from the government. They're getting paid every week from the job seeker. But the student living here right now, the overseas student, they're not getting any help. I don't mean any help, but people like Red Cross Society and all these like Salvation Army, they're helping them, giving them some relief, like getting them food, clothes, shelter to live, which I think is very good from the government. Plus, the economy is going very much down. Everything is online these days. We can't go to the shops. We can't do anything. Everything we have to link online. Plus, our universities, it's online. You can't go to uni. You can't go to college. So it's being very hard. But here we people now we are used to of it. So our government is trying to put some more restriction on it. So what they're trying to do now is they're trying to so what they did now is they have put some armies, military on the road. So if they see people walking without any reason, they fine them like $1,600 to $2,000, can get fined up to $5,000. That's what's happening in Australia. Other than that, let's just see, let's just wait. That's what we can do. Maybe there is always a hope in the end. That's what I said before. So I'm here because of my friend Manish Mehta. He referred me saying, if you can have a quick chat with us about the COVID. Yeah, so I don't have much to say, bro. Sorry guys. That's it. That's what I want to say. Thank you very much.
Okay, thank you, Abhyas Bastala. And one thing I want to share, he's my school friend too. He's my school friend,
Yeah.
and very much thank you, Abhyas, for your precious time. And similarly, I want to inform to all the participants, we are getting many new things. We are interactive with many new speakers. So I have a question in our chat box, and I want to request all the speakers, please join this session from last, because we have many questions, because I have seen in our chat box we have many questions, and I request to our Dr. Nicholas Busal that to please join with us till last hour end of this program, because we have many Nepalese participants today, and they have lots of questions about the politics, about the depression, about the anxiety. And one thing I want to share, he is also the psychiatry doctor, and he also takes many types of training about the psychiatry, depression, anxiety. And thank you to all the participants. Please leave your question in the chat box. And similarly to the next session, we have Saprit Kaur from India. Please welcome Saprit Kaur from India.
Hello everyone, my name is Saprit Kaur and I'm going to represent India in this webinar. Starting with the basic introduction, as at May 18, 2020 in India, 56,342 positive cases have been reported in India, which has population of 1.34 billion, the second largest population in the world. will have to face difficulty in facing the controlling transmission of serving acute respiratory syndrome of coronavirus among the population. Multiple strategies would be highly necessary to handle the other current outbreaks. These include number one, computation modeling, number two, strategical tools, number three, qualitative analysis control. The spread as well as the rapid development of new treatment, Ministry of Health and Family Welfare of India has raised various awareness among the recent outbreaks to take necessary action to control the spread of COVID-19. Now coming to the current scenario, which the statics India is facing right now. Acute respiratory syndrome, coronavirus 2, which caused the disease COVID-19, was first identified in December 2019 in Wuhan, China, and later spreaded in many provinces of China. As per 8th May 2020 WHO documented 37,59,967 positive COVID cases and death toll attributed to 2,59,474 worldwide. On 30 Jan 2020, WHO documented COVID-19 as public health emergency of international concern. Subsequently, a number of cases basically rose in India. According to the medical research in Pune, total number 14,37,788 suspect sample has been sent to NIV, that is National Institute of Virology in Pune, Maharashtra, among 56,342 cases rested positive for COVID-19. Now coming to the economic impact of COVID-19 in India. India's growth in fourth quarter of financial year went down by 3.1%. According to Ministry of Statistics, the Chief Economic Advisor Government of India said that these drops mainly is due to COVID pandemic effect in Indian economy. Notably, has also here witnessing the pandemic solved down by the World Bank. Telling real GDP rates in 2020 as projected by IMF dated on March 2020 caused COVID-19 pandemic, market instability and lockdown. It has several outcomes and I'll tell you that. Number one, sharp rise in employment. Number two, stress on supply chain. Number three, decrease in government income. Number four, collapse of tourism industry. 5, collapse in hospitality industry. Number 6, reduced consumer activities. Number 7, plunge in fuel consumption that lead to rise in LPG. Fall in trade with China. Now coming to the negative impact of COVID-19 on education sector in India. Education sector as well as are highly affected by this COVID-19. It has enforced the worldwide lockdown, creating bad effect on students' life. Around 32 crores of learners stopped to move from schools and colleges. All the educational activities were halted in India. The outbreak of COVID-19 has advised the change is inevitable. Now coming to the impact of lockdown on small, micro, and medium business. 110 millions of people are employed in India. 63 million out of 110 million are employed in medium, small enterprises caught off guard by the lockdown according to MSME in India. Default on debt under the emerging scenario extended lockdown, but each sector faced different challenges. Business in consumer and retail sector is expected to see the drop of 20 to 25%. Now lastly, ending with the building back better. From the business perspective, companies generally cannot be successful in societies that are not functioning well. This is where stakeholder and capitalism has to play their role. Business needs to bring skills and assets to help the investment in the society. We see this very clearly in functioning inclusion. We have to bring on basic sector, public and private sector. Thank you.
Thank you, Saprit Kaur from India. We are very much thankful to you. You have given up your precious time to us, and we know about the India's situation, about the employment, about the unemployment, and have a question in our chat box regarding any types of question on you about the India. If you want to know about the more about the India, about the COVID-19, about the employment, about the government, about the youth, about the medical workers, you can write in the chat box. And similarly, to the next session, we have Adar Nasir Khan from the Pakistan. Please, Adar Nasir Khan, mute yourself, unmute yourself. Sorry, please.
Hello everyone,
Adar
am I
Nasir.
audible? First of all, let me confirm that. Am I audible, Mr. Host?
Yeah. You are audible.
Okay, so I am Adnan Nasir Khan, a student of law from Pakistan. So I'll talk about the current scenario of COVID-19 in Pakistan. Pakistan confirmed its first 2 cases on 26th February 2020, when a student of Karachi was confirmed with COVID-19 positive. It was the first case that was confirmed on 26th February 2020, and then it was followed that on 18th March 2020, our first fatality was confirmed due to COVID-19. But in the meantime, in between 26th February and 18th March, the government had taken different initiatives. If I talk about such as closures of schools, colleges, universities, and postponement of different events, such as the National Day Parade that take place on 23rd March every year. So these different types of initiatives were taken by the government, and in between the government also postponed different activities such as the Pakistan Super League, and if I talk about the football, so different events were postponed by the government of Pakistan. But the main outbreak of this pandemic started in after the March. If you talk about the after 18th March, it was the time when the outbreak of this pandemic started in Pakistan. In April, May, June, it reached to its peak. By 17th June, Pakistan confirmed that each district of Pakistan has at least one positive COVID-19 case. So it was really alarming situations for Pakistan. But by the grace of Allah Almighty, the things has come to the right path. Happened after 13th June, when Pakistan recorded their highest daily new cases by a single day. That was more than 6,000. So what happened after that? The cases, the trend of the confirmed COVID-19 has tremendously gone down. And in July, in the first week of July, what happened? Pakistan sees that the recovery rate of the confirmed COVID-19 has overtaken any of confirmed cases. So therefore, now I talk about the current scenario. So Pakistan has fifth highest number of COVID-19 cases throughout the world, and five high number of COVID-19 cases in Asia, and the second number of high number of COVID-19 cases in South Asia, that is India. So now we have to understand that the COVID-19 has been mainly concentrated in few areas. If I talk about the Karachi, that is the largest city of Pakistan. So the COVID-19, we have more than 90,000 confirmed cases here in Karachi, which is the largest city of Pakistan. So there is more than 30% of the total COVID-19 confirmed positives in Pakistan. Now it has affected Pakistan in various sectors. If I talk about the economy, so we were already in economic crisis, and it has affected our economy badly. We have lost about 2.5 trillion. We lost about 2.5 trillion. We have seen 2.5 trillion loss to our economy, and it is estimated that 27% of the foreign remittance has been lost by Pakistan, because Pakistan has a lot of workers which do work in outside the country, like Saudi Arabia and Europe. So we lost all those persons who were working there and sent their remittance to Pakistan. So it affects our economy badly. If I talk about the health issues, so we have seen that more thousands of people, health workers, they are affected by the COVID-19. So we did not had enough capacity and equipment, safety measures, safety equipments for health workers. It also affected us very badly. But if I talk about the preventive measures that taken by Pakistan, so Pakistan announced economic relief package for those who are daily wagers and laborers. So what happened? We just spent more than 2 trillion rupees, Pakistani rupees, on daily wages, laborers, and these who are below the poverty line. And the government has also worked for them on differently. If I talk about the if I talk about the yes, yes. If I talk about the State Bank of Pakistan, this initiative taken by the State Bank of Pakistan, they said that we will ensure clean, disinfect, seal, and quarantine all cash being collected from hospitals and to block circulation of such cash in the market. It was confirmed that the bank will assure to reissue cash which are quarantined for 15 days. And all ATMs as well as all centers and helplines would be running 24/7. So these different safety measures, Pakistan, including this, Pakistan also closed its border with China from the very first day when China confirmed its first case. So Pakistan closed its borders with China. Then if I talk about the Pakistan's border with Afghanistan, so we also closed that border with Afghanistan for the safety measures. Now it is highly recommended to the government of Pakistan, yes, to do several steps and initiatives for future. For example, the government needs to make different quarantine center in every border of that Pakistan has with Iran, Afghanistan, India, and China. So we have to modern and advanced quarantine center there, and we have to work on our health tool. That is the main issue of Pakistan, that we don't have facilities. And then if we talk about the economies, we are really trouble in this time. So the government of Pakistan needs to take these measures seriously and to do something betterment of the people. So the case has went tremendously now. If I in the death rate of Pakistan, it is 0.1%. That is almost equal to all countries in South Asia. Sorry, it's extremely down, or I can say it's extremely lower than the global average rate fertility rate. Because the global fertility rate is 3.50, and Pakistan have 2.1% fertility rate, which is very low. So I think the government has handled it very good, and have taken different issues we needs to appreciate. And yes, we look forward that inshallah the pandemic will be ended. So thank you from my side.
Okay, thank you so much, Adan Nasir Khan, for your precious time. And I am seeing there is going on interactive. There is going interactive session in our chat box. Yeah, we are really happy seeing the questions and discussions in our chat box. And lastly, we will discuss each and every questions about this program. If you are feel free to ask any questions to represent to one country to another country, about the Nepal, about India, about Pakistan. You can add any questions in our chat box. And similarly to the next session, we have Sri Devi from Malaysia. Welcome, Sri Devi. And I want to request to our technical team to please share our slide in our screen. Sri Devi from Malaysia.
Okay, hello everyone. Welcome to this webinar on COVID-19. Mr. Manish, next slide, please. Before this. Okay, my name is Sri Devi. I'm BPharm undergraduate student from University of Cyberjaya in Malaysia. Would like to share on how my country is managing this pandemic. Next. Okay, the first case of COVID-19 in Malaysia was detected on 24th January 2020, of which the case had travel history to China. Till mid of August 2020, Malaysia had notified further a total of 9,219 confirmed cases and 125 deaths with only 2% of active cases. Initially, the reported cases remained relatively low and were largely confined to imported cases until localized clusters began to emerge in March, leading to massive spikes in local cases and had recorded the largest cumulative number in Southeast Asia. Since there is no specific treatment against COVID-19, the Malaysian government has developed a strict guideline to adhere to during the pandemic. Next. Okay. The medical response to the outbreak is overseen by Director General of Health, Tan Sri Dr. Noor Hisham. Preparation to stockpile equipment, detect and monitor cases, and treat COVID-19 patients were reported to have been initiated as early as 6 January. Next slide. Okay. On 17th March, our Prime Minister Tan Sri Muhyiddin Yassin announced a nationwide lockdown called Movement Control Order (MCO) to mitigate the spread of COVID-19 through social distancing. Residents were not permitted to leave their houses except for grocery shoppings. Apart from that, foreign tourists were forbidden entry to Malaysia. Government and private premises were closed except for essential services. Besides, Malaysians National Security Council coordinated with many agencies to protect residents from internet scams and also fake news. Next slide. Okay. Some restrictions have been imposed, such as prohibitions of mass gathering and closure of worshipping locations and business premises. Besides, Malaysians returning from abroad are required to self-quarantine for 14 days, and also closure of all schools and also universities. Ministry of Education implemented home-based learning throughout the durations of MCO. Despite past condemnation, the Malaysian authorities have arrested almost 15,000 of people for violating MCO order since mid of April. The violators are being fined, jailed, or sent to perform community service as a part of the punishment. In mid-March, vaccine research has been initiated at University of Malaya's laboratory, which previously used to study highly pathogenic agents such as MERS coronavirus and Nipah virus. For economic sector, our Prime Minister has launched an economic stimulus package known as the Caring Package, was used to protect the welfare of the people and to support businesses. It is estimated that nearly 9 billion was allocated to address rising unemployment. On 5th June, our Prime Minister announced the short-term economic recovery plan to alleviate the effects of the pandemic. Early May, conditional MCO was announced, and now we are in a recovery MCO. There would be less restrictions on daily activities. And important premises has been reopened subject to SOP until end of August. However, entertainment outlets are still prohibitions. Next. Next slide. Okay, so COVID-19 pandemic has brought unprecedented turbulence to healthcare institutions around the world. In Malaysia, healthcare professionals are battling with extraordinary challenges in resource, clinical and operational management. However, with the adequate support from the public NGOs, and also government bodies, the constraints were minimized. Several key actions have been taken to improve infections rate and ensure zero infections among staff. Among those are physical separations between dedicated general wards, outpatient clinic, and emergency departments. Screening center were included to prevent cross-infection. Malaysian also facing psychological stress and depression. Our Ministry of Health has published well-described guideline on mental health and psychological support services for individuals under COVID-19 investigations and healthcare workers due to this pandemic. Additionally, taking care of the psychological and physical well-being of staff by arranging special lounging areas for staff members and sharing of publicly donated food items with staff and also their families. Next. Okay, so Malaysia has been recognized as among the 5 nations in the world to have succeeded in controlling the spread of COVID-19. And adding to that, Malaysia was one of the countries where the government's action in controlling the spread of the virus was well accepted by the people. I would like to thank our Ministry of Health and many professions, including healthcare workers, police officers, soldiers, housekeeping cleaners who have been at the forefront in responding to the pandemic outbreak. Since our fight against coronavirus isn't over, we still have to slow the spread and do our part. So let's wear face masks in public, practice social distancing, and follow state and local guidelines. Wash our hands frequently, stay home when we feel sick, since this is not only for ourselves, also for our loved ones and for our future. So let's move forward together, and thank you so much.
Thank you, Sri, for your precious time. And we have another speaker from Sudan, Abdel Nasir Mohammad Galal. Please welcome. From Sudan, Abdel Nasir Galal. And similarly, I want to add one thing. Director of Global Peace Chain Nepal, Shivang Datta sir, we YDS member, welcome you. And similarly, I want to welcome from Youth for Nation. I saw there Lenin Vistadai and more members. We YDS family want to welcome, and all to those participants, directly or indirectly, or from any organization, we want to welcome to all those participants. Thank you for this. And we have a speaker from Sudan, Abdel Nasir Mohammad Galal, please.
I think he's having some connectivity problems, so we can move forward to another speaker.
Oh, okay. We will discuss later. And similarly, we have from Bangladesh, Abid Bhuyan Shravan from Bangladesh is now currently studying MBBS in Bangladesh. Let's hear about the situation of Bangladesh. And I want to welcome Abid Bhuyan Shravan.
Hello everyone, I am Abid and I am here representing Bangladesh. So at first I want to talk about the current situation of coronavirus in our country. The total number of confirmed cases in Bangladesh till date is 285,000. The total deaths for this pandemic is 3,781. However, it is a matter of relief that the total number of recovery is 166,000 people. So I want to start it from the first. The COVID-19 pandemic, which is a pandemic, worldwide pandemic due to the severe acute respiratory syndrome, coronavirus 2 or SARS-CoV-2, which was first outbroken in Wuhan, China. The virus was confirmed to have spread in Bangladesh in March 2020. The first 3 known cases were reported on the country's epidemiology center on 8th March 2020. Since then, the number of the infection has increased day by day, along with the dates for this pandemic. In order to protect the population from the the government declared lockdown, or the term they used is general holidays from 28th March, which extended to 30th May, and the government prepared some necessary steps for its population so that the virus couldn't be spread throughout. However, infections remained low until the end of the March, but a steep rise was shown on the graph in April. On 6th May, the COVID-19 cases were confirmed in all the districts of the country. After that, on June, the total number of cases in Bangladesh exceeded the total number of cases in China, the country where the outbreak began. So Bangladesh is the third most affected country in South Asia after India and Pakistan. So if there are some facts which must be mentioned. Medical experts in our country have always feared that there are not enough tests were being conducted in our country for this pandemic. Newspaper reports and also social media suggest that there are additional deaths of patients with COVID-19 symptoms which are not included in the number of the deaths. Some of the deceased were treated at COVID-19 isolation center. However, many of them were untreated or denied treatment. Besides, a series of hotline numbers, email addresses, or Facebook pages were introduced to the people in general for their information about this pandemic, or if they suspect any COVID-19 infection, they can freely contact with them. Bangladesh faces significant problem in combating COVID-19 pandemic because of some reasons. They are, first of all, it is a densely populated country. Bangladesh is a small country, but it has a huge population. So it faces the population problem from the very beginning. Besides, it houses a million of stateless Rohingya refugees from Myanmar. So it was very tough for the government to handle all this much tough situation in for the refugees. It has also significant number of migrant workers working in Italy, which was one of the greatly affected country of COVID-19. However, if we talk about the government response, the government first of all gave its priority to social distancing. At initial periods, Bangladesh Army and the Bangladesh Police conjointly worked for maintaining the social distance among the rural area or in the urban areas. However, ending the lockdown appears to have been primarily driven for its concern regarding its economic impact. Prime Minister Sheikh Hasina said economic activities have to be resumed for the sake of lives and livelihood of the country. The travel and entry restriction. On March, on-arrival visas were suspended for all the countries, and flights from all the countries other than United Kingdom were banned. However, international flights began to resume on June 2020, but in a small margin. If you talk about the treatment in Bangladesh, there were serious lackings of ICU beds and ventilators because we are developing
I think we have also network problem. Well, it got muted. Please, technical team.
vaccine. If I want to talk about vaccine, in July 2020, a Bangladesh company named as Sinovac Biotech was giving approval of Bangladesh Medical Research Center to begin a third phase trial of potential COVID-19 vaccine, which is the first potential vaccine of COVID-19 in Bangladesh. Impacts. If we talk about the impacts of COVID-19 pandemic in Bangladesh, if we talk about the economic impacts, COVID-19 pandemic has heavily impacted household and individual level earnings in Bangladesh, with 13% people have become unemployed. However, our Prime Minister launched various stimulus packages for health workers and others professions education. Bangladesh has approximately 0.2 million institutions and 14 million students. In March, Bangladesh closed all of its educational institutions in order to reduce the spread of COVID-19 virus. However, online classes were being conducted by most of the institutions. Migrant workers and Rohingya refugees are greatly affected for the coronavirus condition in our country. And I would also like to talk about the mental health. Yes, Bangladesh, after being quarantined, many of the people are facing various mental problems. They are suffering from anxiety, they are suffering from depression, and the suicide rate is also a thing of concern for our people. The health workers are also at great risk of this pandemic. So now, after all these things, we have come in a situation that we cannot deny the health rules. We must follow the health rules. We should stay home without, if we don't have any work outside, we must stay at home, and we should wash our hands frequently and use mask and other safety measures for our own safety and the safety of our country. Thank you.
Thank you, Ovid from Bangladesh. I have a precious time. Yeah, we know about the Bangladesh also, and we have left more 2 countries. And after that, we will have the question and answer discussion. And I want to say one thing that about this program. Today's about the 9 countries, about the program engaging those countries. Will make one article or report and will post in our Facebook page. And I will, and from our YDS Youth Development Society, every speakers of their Gmail and from our Youth Development Society, we will send this article in every speakers of in their Gmail, and must everyone read that. And we have the journalist also, and I want to thank you to Darshana. Yeah, he is handling today's program about what the situation is going on, who the speaker is coming on, what are the points they are telling here, and she will add in article or in report everything. And we have a speaker from Haiti Wood Center, and I want to welcome him. Please take the floor, Wood Center from Haiti.
Okay, good morning. Depends on the time that you have. My name is Woodsender, and I'm happy to represent Haiti to talk about the pandemic, COVID-19. So the first 2 cases were announced by the president of Haiti on March 20th, 2020. And then a week after that, the whole country was on quarantine, lockdown. They announced it, but people didn't really respect that. So people would do their stuff, go to their places, except for churches and schools. Those were closed for like 3 or 4 months. So in Haiti, we have 7,921 confirmed cases, people with COVID-19, but we have more people that have no coronavirus anymore than people who died. We have like 5,235 people that they are treated from COVID-19. And then we have 196 people that died from COVID-19, and then 2,490 people who are still fighting with COVID-19. So the whole country isn't on lockdown anymore. People can do what they want and go where they want, but they have to respect certain rules. You have to wear a mask, even if most people don't want to. But if you go to like a restaurant, or if you go to an office, you have to wear a mask. Otherwise, they won't let you in. And then in my town, we don't have a lot of confirmed cases. We don't have a lot. Not because people respect the rules. I don't know what it is. People say that it's just a grace because they don't respect the rules, but it's just a miracle that we don't have a lot of people with COVID-19. And then most people don't get tested. We had a fever that was going on, and people didn't think that it was coronavirus at, at, at the beginning. But at the end of it, they discovered that it was COVID-19. But they didn't die from it. Most people, they use tea, because we have a lot of herbal tea that they can drink. So they use that, and they use a lot of national medicine, if I can say it like this. They use ginger, they use honey, they use all kinds of stuff to kind of help with COVID-19. And they have been so far successful with their medicine. And Haiti is one of the countries that have a best that have controlled corona at their best. And they're not doing perfect, but they're doing okay so far. So our problem isn't just COVID-19 now. Not only we have COVID-19, but we have also political unrest that are happening. That is not good for Haiti, because yes, we are not in lockdown anymore, but we still have the COVID-19 here. People don't know that now schools are reopening. I think that schools are reopening, and then churches after 5 months. 5 months, not because of COVID-19 only, but because of political unrest plus COVID-19. So now schools and churches, they are open back up. Some parents, they send their kids to school, but some cannot afford it because they have been out of work for like so long. And some of the parents, sorry, they are just afraid of the pandemic for their kids, so they just keep their kids at home, not because they can teach them, but we don't have a lot of hospitals that are well equipped to help with corona. So the best way for them to protect their kids is to keep them at home. So yeah, so far Haiti has been doing very good. I don't have the update about the pandemic for this morning because it's early in the morning, but I think that we've been doing pretty good. The government isn't doing a great, like a perfect job. They are preparing election, something that is always a bummer in Haiti. So somehow the pandemic is kind of like they kind of stopped talking about it a little bit, but it's still present, right? It's still present. So yeah, that's it about Haiti. We have 2,490 people that are still fighting with Corona, and 196 people died from Corona. Thank you.
Okay, thank you, Ursender, yeah, for your precious time. And I think everyone is getting a lot of experience out from this program. And this is, I told earlier also. This is different than others. This is different than previous day webinar, because here we have different speakers from the international countries. And finally, we have last speaker. And after that, we will go on question and answer discussion. We have last speaker from Sudan, Abdel Nasir Mohammed Galal. Please take the floor. And this is our last speaker. And so, guys, please write your questions in our chat box. And after this, we will discuss our every question, each and every question, which is included in our chat box. Thank you. Thank you. Please take the floor. Abdel Nasir Mohammed Galal. I think due to his network problem, he can't be able to join, because from early he is joining and leaving, joining, leaving. I think his network problem is, yeah. Our technical team, what, he will join or not? Please confirm that. Otherwise, we will move towards the next session. About that is the question and answer discussion, and that will be the more interactive session. Please confirm. Please confirm. You can unmute yourself. Okay. To Abdel Nasir Mohammed Galal, if you got invisible network, then we'll welcome you in middle of our question and answer discussion. And due to the lack of time, and our speakers from the each and every country, from the 9 different countries, have waited from earlier until now last, and we are very much thankful to every one of the participants, to speaker from our YDS family. And let's move to our question and answer discussion. And I will take serially question, and if you are asking the question regarding to any countries, then the speaker of that representative country will have to say that answer, and I am going to ask the question. Yeah, there is question. Nicholas Busal, Dr. Nicholas Busal, I think he has also left due to his personal work, because he is working in hospital.
No, I'm here.
Sorry, that I haven't seen you.
No, I am here.
Yeah,
I'm just listening everything.
Oh.
Yeah, it's amazing meeting right now.
Sorry. Yeah, you can also question one by one and tell the answer that if that will be feasible for you, it will be very easy.
Yeah. What are the contributions that youths can give? I just want to know one thing from all the speakers. From our side, what is the best thing that we can do right now, and what we are doing, what they are doing in different countries, and that's what I expect from everyone. Like from Bangladesh, from Australia, what's the role of youths in this critical crisis situation? Wow, how we can cope up with this situation? I just want to know the idea from all the leaders from all the countries. Manish, I just want to ask one thing, brother.
Yeah, Rajesh. Yeah, you can ask.
Yeah, what are the things that we youths can play, and what are the roles that our friends are playing in different countries, and what is the best thing that we can do right now? If we can discuss, then I think it's better. Like on India, on Pakistan, on China, what's the government is doing
Yeah,
something, the concerned authority, yeah, some ideas with
yeah,
everyone.
from Cyrus Sovidi from Nepal. He told stay home, stay safe, away everyone about it. Yeah, please write the answer in your chat box. Make more interactive session.
Yeah,
Please, everyone, please don't write question only. You should have to give answer also. So please be interactive.
yeah, we can stay home, we can stay
I think
safe.
we have to follow the safety measures because we know that there is no vaccine made for this COVID-19. So we have to follow the safety measures first, and then we have to avoid these large masses areas because it has been highly threatening, and the COVID-19 spread through these large masses or through crowd areas, we can say. So we have to follow, and the most important thing is that we have to connect socially, what we can say through social media. We have to connect with each other because lots of people are facing anxiety and depression because no one is contacting them, or he has been in self quarantine or isolation from a month or more. Even I'm myself in self quarantine from the past 2 months. So you can say that how difficult it is for a person, to remain in quarantine for a month or two. There's extremely difficult. So if I talk to someone on social media, to my friends, so it will, give me the relaxation type, you can say, or it won't lead to the anxiety or depression that we are facing, because the anxiety and depression, that mental diseases have been went very high. The percentage or the average of these diseases on this COVID-19 has went tremendously high. The reason behind this is that we are most of the people are either self quarantine or they are in isolation. So now no one is contacting them, or everyone is busy in just doing his own work in isolation. For example, if I say that most of the people are just doing their online classes, or we can say online work through social media or through different platforms. So I think we have to, first of all, we have to follow the safety measures because it's extremely important. It is the only thing or the only chance that we can say that to avoid or to control the COVID-19. There is no other main thing that we can control the COVID-19 to. And the second thing, we have to follow the initiatives that has been said by the government, because the government is really, really worried about our health, and they are trying to ensure our safety. So we have to follow those initiatives that are that have been given by those instructions that has been given by the government of your own country. For example, the government of Pakistan has taken different initiatives. So we have to follow. We have to remain in contact with each other through social media, not physically contact, because it is really threatening, or we can say alarming it is. So we have to do these types of things, and let's hope for the best. So I think there is the safety measures we can do.
Yeah, thank you, brother. And yeah, we can obey the rules, so we need to isolate ourselves, and we need to make people aware of it, and we can help if people. And sometimes there is, because of some economic crisis, and some people may not have got enough foods, and we can supplement them the foods by different measures. We can help them economically or various other issues. And what actually we think about the possibility of vaccine in this time. And from everyone, I just want to know, what do you think about the possibility? And something going on like this China, Taiwan, and America, and this China, Russia, and lots of things over there. But just positive, and there's just one thing positive is that, and they're just completing themselves for the vaccine, and another thing is they're just blaming each other, and something like negativity or war or something is going to be something said like this. And what do you think about, what do we think about this? And
So I have a question to Nicholas Busal. So can I?
yeah, sure,
So
sure.
according to my research, it is said that people with high immunity power is likely to have less chance of getting COVID. If it's true, and then tell us about some good food habits that will boost our immunity power and help us to get likely to get less COVID. If we have any good food habits, then.
Uh, Really, thank you, Darsana. Really, an amazing question. Right now, everything is related to what we take, food habits, and immunity. Just I want to say something about immunity. Immunity means something, our fighting capacity with any virus, any bacteria, fungi, or anything. And our body is has a defense system like army, police inside our body. And to make it more strong, we need to make our immune system strong. And for that, we need certain food habits that are more appropriate during this time. Uh, During this time, what we need the most is the protein, because immunity is mainly generated through antibody generation and also through the development of various type of different cells that our body needs during this time. And protein rich foods like we need to take various like soybeans, meat, and fresh fruits and vegetables, because our to boost our immune system, to make our immune system more strong, we need a lot of cell regeneration, for regeneration of our cell. For rapid division of our cell, we need various vitamins like vitamin B, vitamin K, vitamin E, which are mainly antioxidants, like vitamin A and vitamin E. The foods which are very rich in vitamins are green vegetables. There is current, there is no electricity right now in my home. I'll just make the light. And the various other food habits that we need to do right now is we need to have a healthy lifestyle. Healthy food habit means that what we can do right now is daily our pattern of eating, like we need to take daily 4 times food. On the morning, if you take some vegetables are very rich in antioxidant and also in the various vitamins. It's very good. Along with that, we need to take much higher quantity of water than before, because during this time or during any infection or during this time, we need to boost up our immunity, means we need to boost up our basal metabolic rate. We need to do a lot of exercise right now, because if you don't do exercise by staying at home, then our body loses its immunity, because immunity depends on our physical activity, immunity depends on our food intake, immunity depends on our uh, daily behavior, immunity depends on our mental thinking. I just want to say three things is more important. One is diet, one is daily exercise, and another is this mental preparedness. And the food habit that is best for right now is every morning we need to take some fruits and vegetables, fruits and water, along with some juice, fruit juice, and milk is very good. We need to take the daily food for diet, and during the lunch we need to take the lunch which is good in protein. Like we need to take some green salad, we need to take some soybeans or some curry or some dal type of things and cereals grain. And at the evening time we need to take something which is more, which boost up our body system and which we like very much. Like along with, we need to reduce the quantity of dry food that we are taking, because dry food has cause dryness on our stomach, and it also decreases the uh, absorption power of our gut. And at the night time, it's better if you take the meal before between 7 to 8, and then after that, our body will get enough time to make a proper digestion before going to sleep. And other thing is daily exercise. We need to exercise at least 1 hour a day, in the morning or in the evening. It grows up our immunity and it increases the fighting capacity with the brain. The main thing behind this is the mental preparedness. We need to be prepared mentally. Like if something will come, then I will just resist it. If anything is there, because right now the main problem right now is the social media. Whenever we see the social media, there are very few things that are positive now, because there is some news of death, some news of infection, some news of corruption, some news of these various type of things, because of economic crisis, because of many things. And we need to get rest from social media for some time, and we need to enjoy with the nature, enjoy with the surrounding, enjoy with the people we are with. And it's most important, the healthy diet habit needs to be, the diet should be rich in protein, rich in fruits, rich in vegetables, rich in these vitamins, rich in juice. And at least we need to drink 2 liters of water per day, and we need to at least we need to lose our calorie around 2000 calorie we need to lose daily, because we are not doing anything. To lose 2000 calories is a bit it's much more important, because if we don't work hard, if we don't do physical exercise, then it's maybe very difficult for us for the next time. The main thing that you need right now is the mental confidence. Thank you. Yeah.
Please, if you have any question, we are
Yeah, one
making
question
this
is there.
session
One question
more
is there
interactive.
from
Yeah,
Sairaj
yeah.
Subedi. Yeah, it's important question. Does Nepal have enough health facilities to handle the situation at community level? Actually, if we see compare the health status of our country, then there are 27,000 doctors and 20 various pharmacists and various health professionals in Nepal. Right now, if it's go to the community level, it's gonna be very difficult. It may be out of control, but there are 4 types of strain of virus that we are getting of COVID-19 virus. In Nepal, it's D type strain. It is different type of strain, and the mortality rate right now in the Spain, in Italy, the mortality rate was around 20%. But in Nepal, the mortality rate is less than 0.5%. That's why I think we can control it, and lots of things are going on right now, like the number of test is also increasing. But if it spreads rapidly, initially we could have controlled it, because if the borders were tight, if the screening were done properly, if the people coming from India or coming from other countries were checked initially, then it may not have reached at this level. And we are a bit late right now. But recently, what doctors or government is increasing the number of tests, increasing the number of manpower. Right now also they are asking for the manpower to handle it. I think we can control it if it goes to the community level, but it's very difficult. It can be very difficult. If the virus takes the virulent form, then it's difficult. If it's take the simple form, then we can control it.
Okay. Please unmute yourself and ask the question. Yeah,
Yeah,
from
I have
Ganesh
got one
Rajbangshi.
question from Ganesh Rajbangshi. My question is to
Okay.
Nicholas Nisar, and that we in Nepal have limited number of ventilators and medical kits for treating COVID-19 patients. As you know, the case increasing day by day, chance for the number of patients to be higher. So I need to know the preventive measures that we apply to be safe to get far from this COVID-19. As I hear from somewhere from social media, the mask we wear it's also not highly protective since the virus is growing rapidly. Yeah, Ganesh Rajbangshi, thank you so much. And yeah, really, there were only around 400 ventilators at the beginning of this COVID-19 during this Chaitra or during this May. And when the first case was there, and we went to the government, we won many times. We need more ventilators, and there were few people like Vijay Acharya and Nepalese Biotechnology Society and various other person, and even Mavir Kun was there in the ministry, and he said that we need a lot of ventilators, and this is the way that we can make the ventilators in our place. And we tried a lot, and they said that we can make the ventilator in our place, we can make the respirator, we can make this bag and max bulb in our country, and we need it a lot of case. And the government was something like, okay, very nice, I'm not doing anything. And after that, right now the number of ventilator around 437 or something like 500, around 500 ventilators have been donated by different countries to Nepal. And this PA, PR, this max bulb are also donated few times, like from Korea. from Japan, from China, and various other countries, and they are not sufficient because already to get ventilators in Kathmandu, to get ICU in Kathmandu is something like to get a gold medal. Something is money snow to get a ventilator in even teaching hospital. It's very difficult, and right now the ventilator, the only thing that's good right now in Nepal is the infected people are not so much serious, so much critical at this right now. And most of the people that have died, they have comorbid illness with them. That's why the people are dying. If it's go to the community level at this time, and the marks that we are, majority of people, that's the marks that we are using, and other PPE or something equipments that we are using, it's not proper because I see most of the people, many of the people from beginning, they are using this cotton marks or the marks with pour around 16 or more, and which is not protective for virus. Like they are making marks from anything, like from copper, like from cotton, like from nylon, like from old clothes, like the marks that is made by the police. Initially, the marks made by the police was not protective itself only, and at that time we talked to Nepal police, and that's why I think the main thing we need to do right now is segregate yourself from anyone. Just isolate yourself. We need to be in home quarantine. We need to be in self isolation, and that's what we can protect us. And we can spread a warning. If you need to go outside for many reasons, for basic reasons, the majority of the problem can be solved by digitally also. If you are sick, if you have some queries, then we have some platform like Amropatro, Encel, and Doctor on Call, and there are many Amro Doctor, and even you can message us, and we'll help you. And we have team working on this to provide the digital treatment, so that right now the best thing is to connect with people, spread awareness, spread good things, and wear masks that is protective, like surgical masks, KN95 or other masks, not this cloth masks or not this cotton masks or something like this, protective items, and get the PPE or other items from authorized source so that it will protect you. And I've seen some people just wearing the raincoat and saying it's PPE or something like that. And I think it's time to only one thing, one person can protect you from COVID-19. That's yourself, and be prepared for anything. But for now, many days can people stay in self-isolation. We need to know.
Nicholas, I want to request one thing. Please take only 2 questions because we will end this session, and due to the lack of time, take only 2 questions and conclude it. Yeah. One take, does gene plays a role to fight against COVID-19, and how can people cope with psychological impacts of COVID-19?
Okay.
Okay.
Yeah. Right now, what I'm saying from the first is the psychological impact of COVID-19 is more dangerous than the actual impact of COVID-19, because the death due to COVID-19 is only 126 today, and the number of cases, reported suicide cases, is 2100 in our country only. And the economic impact of this disease is much bigger than this medicinal impact or epidemiological impact. And to get motivated during this condition is very difficult, and we need to be happy for what we have, because every morning I used to be happy, or we used to be happy because we are still alive, we are breathing, we are doing lots of things. And but about and there are some questions: how long can we get motivated? How long can we stay in self-isolation? Because we need to work for money, we need to work for our family, we need to work a lots of things. During this crisis time, what we can do best is the mental meditation. Meditation is the best thing that we can do, because if we believe in ourselves, if we believe in God, if you believe in something like, if you just enjoy the nature, enjoy the time, and during this time, I think you need to do research about whatever you are planning. If you are a student, then you can study. If you are planning a business, then you can do a research during this time. If you want to start a government job or something like this, then we can be prepared for it. If you want to have interactive session with anyone, then we can interact with them. And one thing is there, if you don't do anything for 3 months, then you are psychologically ill, you are mentally ill. It's true. And that's why it's already been more than 5 months. Everybody of us are psychologically ill. To make the best utilization of this time, because we need to see the surrounding, we need to see the people, we need to see ourselves. The first thing we need to be motivated is we are actually alive and we are working and we are doing a lot of things, like we are doing like many people, everybody are doing something, like they're doing research, they're doing various things. The main thing, daily, you need to make a daily hygiene, daily habit. Okay. And at every morning you need to wake up, you need to just to exercise inside your room, you can go outside. Then maintain physically healthy. If you be physically healthy, then mental stress will be relieved from physical health. And second thing is taking healthy diet like fruits, vegetables, and green things like this. And when you see the social media also, main problem right now is the social media that's spreading a lot of things. We need to be social. In the social media, you can look at the nature, look at the beautiful things, look at the motivation speech, look at the motivational thing, look at the beautiful things over there, rather than just seeing the news, seeing the messages and everything. The other thing is be prepared for what you want to do next. It's the best thing, it's the best strategy that we can do right now. If you want to do something good in education, then you can study. If you want to do something good in business, then you can do a lot of research, a lot of data, a lot of interaction about it. If you want to do something, job or something like that, be prepared for it. Be prepared for if you want to do something like a small shop or something like that, and make a research, make a protocol, make a planning, and make a schedule daily. At the morning, I'll just wake up at this time, I'll just do exercise, I'll just do this type of things, this type of things. I'll see one movie, I'll just see one motivation, and the daytime I'll just do this, and at the evening time I'll just do this. Be happy, just to keep on smiling every second, every time, because if you try to smile, then automatically it comes. Just be happy. For just remember the good things that you did in the past, what good things you can do in the future. Just keep the faith within yourself, keep the hope within yourself, and try to make the maximum time utilization through social media, through digital media. And right now, it's not so much difficult to do your work through digitally. You can do some social work, social activities. If you are so much frustrated, you can. There are lots of problem over there. You can go for a solution. You can share your ideas. You can get positive ideas from other things. That lots of things we can do right now.
Nicholas Dai, and we are in our ending session, and I want to inform to all the participants and speaker that one thing, we by tomorrow or day after tomorrow, all the participants will get the certificate of participation from our Youth Development Society, and all the speakers will get the certificate of appreciation from the Youth Development Society. And again, from myself and from our YDS family, we are giving very much thank you to all the speakers and participants. And thank you, and very much thank you, Dr. Nicholas Busal Dai, for your precious time, Dai. You are very grateful.
Really, I'm very much excited. I'm really thankful to Youth Development Society, because the future depends on what you think. Let's think positive. Let's share the hopes. Let's keep the hope, and together we can grow and we can do a lot. I think so.
Yeah. Okay, let's end our meeting.
Yeah, Nikhil Kumar said that you didn't give my answer. I just want to know the answer. Question of Nikhil Kumar, Nikhil brother,
okay,
and
last question. This is last question. This is last. Yeah. This is our last.
You didn't give my answer.
His question is that does gene plays a role to fight against COVID-19? His question is, does gene plays an important role to fight against COVID-19?
The gene of the virus or the gene of ourselves. Yeah, many bacteria or virus, they are very affinity with certain genes, and research is going on, brother. And there are various around 86 different strain of COVID-19 virus have still identified. And if you see, I think gene plays important role, because the impact that is seen on the Spanish people is not same as the impact seen on Chinese people and the other African people. The impact is different. I think that's why I think gene plays a role, because our strain also is different, and the impact is different with us, with the people from India, with the people from other countries. And I think that's something genetic is there, because almost on every virus and bacteria, the gene has important didn't play a major role. But it's
Okay.
still under research. I'll just make a research on that, and I'll just let you know soon.
Okay. Okay. Okay.
Thank
We
you.
are going to in this our session, and we will have more interactive program. Please follow our page, and we have weekly scheduled program, and we will again welcome our main speaker, Dr. Nicholas Basal, for more interactive session. Yeah, because many
Thank
youths
you.
are inspiring from our Dr. Nicholas Basal, and I am working from 1 year with Dr. Nicholas
Yeah.
Basal, and thank you very much. And to our technical team, please in this our session, and thank you so much to everyone. Thank you.
Really, really thankful. Thank you, everyone. Yeah.
Thank you. Please in this session, technical team.